Good afternoon. Thank you for joining the RPI View. We're going to be discussing the supply chain pandemic preparedness presented by Lisa Rogers and Sarah Concannon. Went too fast. I'm Lisa Rogers. I'm a senior supply chain consultant. I'm experienced and certified in the supply chain management S3 as well as Cloud Suite Supply Management, FSM. I've been the lead consultant on various projects here at RPI. I've done optimization and process improvement, as well as MSCM, RQC, punch-out, recall, management deployments, as well as new and net new and upgrade application support and training engagements. Before joining RPI, I worked for a supply chain analyst for a healthcare system. I ultimately moved up to their loss and system administrator, and then they replaced Lawson with another ERP. So I was the project manager for that ERP conversion, and I am based out of the Tampa office.
Good afternoon, everyone. I'm Sarah Concannon. I am also a member of the supply chain team here at RPI and a project manager. I am experienced and certified both in supply chain management and Lawson S3 and Cloud Suite Supply Management, which we typically refer to around here as FSM. I tend to specialize in optimization projects in the supply chain area when I'm not doing project management, and a lot of focus on process improvement and documentation is really kind of my jam. Before joining RPI, I was a purchasing specialist and an inventory control analyst for a large health system in Western Massachusetts. And my responsibilities there included pandemic supply management. We were lucky enough to have enough space there to have a separate warehouse space to manage those supplies, which was really great. I am also 39 weeks pregnant. Did not think I was going to make it to this presentation, and for all I know, I could go into labor during it. So
please don't do it.
I get through the end of this.
I don't want to go it alone. No.
I'm here now. Let's do this.
So today we're going to do an overview, foundation of preparedness, pandemic life cycle, managing the crisis, recovery, and then we'll have a question session afterwards.
Yep. So we'll start off with our overview. You know, as I'm sure all of you attending know, pandemic situations aren't a great time to be riding your bike as you build it. But I'm sure that, you know, that's preaching to the choir and is something that a lot of organizations have found themselves doing anyway, because they didn't have any other choice. The situation is really unprecedented. But it's uncomfortable, it's messy, it's inefficient, and oftentimes expensive. So really what we're going to go through today are the tools, the things that you can do, the processes that you can put in place, the steps that you can take once we're kind of out of the woods to be better prepared for the next pandemic. But we'll also go through some things today that will help you you know, as we're still in the midst of this COVID-19 experience.
So thinking ahead, after this COVID-19 crisis begins to resolve and your organization will be faced with a decision, you can either take a gamble and do absolutely nothing and wait for the second wave to come around or a new crisis, or you can review your lessons learned and build your preparedness framework and strategic response plans for the next time.
So our major components of pandemic response is understanding the who, where, what, and how. I won't read through all of these questions, but you know, these are some of the topics that we'll be covering over the course of this presentation. And this really just forms, you know, the answers to these questions forms the foundation of solid pandemic preparedness and also the quality of your response in these situations.
So we're going to move on to the foundation of being prepared, or preparedness. You have to assemble your A team, establish a committee or a dedicated team that will walk you through this crisis, and make sure you include the right players. It's not just about supply chain, it's including your clinicians and your physicians, infection control, risk management. Make sure you have the right players on your team. You want to make sure that you meet regularly. You want to develop policies and procedures. I mean, the last thing you want to do during a crisis is trying to develop new policies and procedures. You may already have them for your daily operations, but you also need them in case of emergency. You also want to monitor your industry trends, and throughout the course of time, you want to stress test your response and action plans. You want to make sure that what you have in place is actually going to work. In the past, coming from a healthcare environment, trying to assemble the A team was like twisting arms, trying to get people to play on the team. So you want to make sure that you have them identified long before they're needed. So twist their arm now and get them on the team and establish a great team that can walk you through the pandemic.
Yeah, and we want to talk a little bit about risk management. So you want to come up with a risk management plan. It really begins with identifying your organization's risks. It's a simple start. What are your risks to demand, to your supply? What environmental and business risks do you have to consider? Management and control, and also mitigation and contingency risks. So demand and supply are pretty straightforward. Environmental risks are really anything socioeconomic, political, governmental, or actual environmental factors. And your business risks are things like really anything that would fall under the umbrella of changing the way you relate to entities that you depend on to keep your supply chain running smoothly. So that also includes disruption to standard personnel management or your reporting business processes. And when it comes to mitigation and contingency risks, what we're talking about there are really the risks that you are opening yourself up to if you don't do this kind of planning ahead of time. So it's the fallout that occurs when your organization doesn't have a contingency plan for supply chain disruptions, and really are just kind of caught not knowing what to do and how to respond effectively when these things do happen. So you're then going to want to create a risk management framework. And again, just start basic. You don't have to reinvent the wheel with things like this. You can leverage what's already out there. PPRR is a common risk management model, and it just stands for prevention, preparedness, response, and recovery. So you're safeguarding against supply chain disruptions. You're having a contingency plan in place in case of emergencies. Obviously, this sort of thing goes beyond just pandemic responses and would include, other types of disaster responses would be covered by this. Execution of that contingency plan that you've created, and minimizing the total effort to eliminate those disruptions, as well as a plan to get back on track. How do you recover when everything is starting to return to normal and get back there as quickly as possible? And then once you've established your risk management plan, after listing out all of your risks, you want to have a way of monitoring those risks. So it seems obvious, but have one location where all of those risks are documented. Score the likelihood and the impact of each risk to kind of show you on a matrix, where each of those lie. Identify your organization's risk tolerance. From organization to organization, you're going to have a different level of tolerance to some of these risks based on, your resources, your ability to respond to them versus other places. So you want to get a good gauge for that. You want to define a mitigation plan for each one of those risks so that you can better handle them if and when they come up. And then you want to revisit that risk scoring and your mitigation plans regularly, because those things will change as your organization changes over time and as the overall environment that you're operating in changes over time. So this risk evaluation graphic is just kind of a basic way to show you how to think about these things. Just gauging your likelihood of experiencing those risks versus the impact of those risks, and then figuring out where on that spectrum your particular organization's acceptable level of risk is for that.
One of the ways that we can prepare is to make sure we have a list of pandemic supplies, and AHRMM does publish a list, and that's a list I have up on the screen: gloves, isolation gowns, goggles, all of that, especially for COVID-19. A lot of these came into play, but this list may grow as you determine whatever the pandemic reactions are. Currently COVID-19 affects more than just PPE supplies, because now we're hearing that it's affecting your renal supplies. So you need to make sure you have all your dialysis supplies as well. In working on this presentation, I was able to talk to several companies on what they did for COVID-19, and a lot of them stated that they simply took their clinicians or a clinician, walked the warehouse for potential items. So yes, we have a great starting point, but there are also things that will come up as you go along, and it's important that you identify those early on. So this is a great starting point, and then you will continue to grow your list. Formalize your tribal knowledge. So it's great if you come up with an A team and you have all of the right people in place. You have your physicians and your doctors, and of course you're going to have admin and supply chain staff and finance folks, and you're going to have this great team, but you need to make sure you document it, that it's thorough, that it's organized, that you maintain that documentation, not just during the crisis, but throughout the year, and that it's easily accessible. We're planning for a second round of COVID-19, so now's the time to get that documentation maintained and make sure that it's accessible for the next round. And don't wait on your training. Know your roles and responsibilities. Make sure your staff knows their roles and responsibility. Have a primary and a backup. God forbid, your primary comes down with COVID-19. You need someone to be able to step in and not skip a beat. So make sure that you are trained. Make sure the documents are completed, and then your system functionality during a crisis. It's not a time to try and figure out how we're going to document substitutes or how are we going to pull the information out of the system. And we'll go into a little bit more of that detail in the upcoming slides. So know your items. How do we know our items? How are they identified in the Lawson Infor system? You can identify them by the UNSPSC codes. You can use item attributes where you can set an attribute that says COVID-19 or pandemic or PPE. There's another way that you can do that is by using your purchasing and your inventory classes. If you're not using sales class, you can actually hijack your sales class and mark it pandemic supplies so that you can pull queries quickly on all of those supplies. Define alternative distributors. The moment COVID-19 hit, a lot of distributors put your companies on allocation, so you're only getting a certain amount. So what's your alternative distributors? Identify your approved substitutions. And Lawson has a great way to do substitutions, and we'll get into that in a moment. Sarah, go ahead.
Yeah, so we want to talk first through, some of these aspects that Lisa just listed off. UNSPSC codes, that stands for the United Nations Standard Products and Services Code. It's really just a taxonomy of products and services that are used for e-commerce. It's really comprehensive, and really every product out there has what we typically refer to as an unspec code affiliated with it. A lot of organizations aren't necessarily using unspec codes today, but it's definitely something that we would recommend. The full code listing is available for download in comma-separated value format right from data.gov. It's maintained there, so you can download it easily whenever you want. There are some steps that we'll walk through quickly to get that set up and have you be able to use it in your system. But as far as getting the code that pertains to your individual items, you can usually work with your primary distributor to get a lot of those going, or other partners. I know that sometimes Epic can provide those to you. So there are a couple different sources for actually identifying your item-specific codes. And down the bottom of this slide here, you'll see just an example of how this code is broken out. So there are 4 sections or levels of the code. There's segment, family, class, and commodity. So ultimately, these really are just a form of commodity code, which may be a term that some of you are more familiar with. And it just groups everything starting from the highest level down to the much more detailed level for each item.
Okay, technical difficulty here. Our screenshot is not populating. There we go.
Yeah, okay. So like I was saying, first things first, you actually need to load the unspec product codes into the system. So this is the screen that you would use to do that. That's going to be your first step if you do want to implement this. And then here is where you would see the specific item code residing within IC11 or your item master record. So on the classes tab, you see displayed there segment, family, class, and commodity. If you are having to assign any of these yourself and you can't get as far down as the commodity level of detail, you don't have to populate all of those fields. You can just do it kind of as far down the chain as you know, and go from there. But if this is something that you're going to institute, you want to make it a required part of your item add process so that going forward, you're populating those in the system. And next we have attributes. So an attribute, the description is kind of vague, but it's really just a field that holds information that you can use to group records for reporting or inquiry or processing or a variety of reasons. In Infor Lawson, there are all kinds of different things that you can assign attributes to. Really, for this purpose, we're just focused on the ones that would be assigned to items, for inventory control, purchase order, warehouse, things like that. And similarly to unspec, you do have to define these attributes in the system first. And once they're defined, then you assign them to an object. So the object in our case would just be the item. And then once attributes have been defined and assigned to the item object, then you can actually go in and assign them to specific items through IC56 here. And attributes are nice because a lot of the canned reporting in the system offers you the ability to enter attributes as part of the parameters for running those reports. And it's also a one-to-many relationship, which is different from the unspec code, or if you're using classes. You can essentially assign as many attributes as you want. There may be a limit, but it's pretty high if there is one. So you can assign a variety of different attributes to each item in your catalog. Purchasing class. So as Lisa was mentioning, purchasing classes are another way to categorize your items. You also have inventory classes, and you can leverage sales class as well. If you're not currently using sales class, I know a lot of organizations aren't necessarily using any of their classes, but if you did have inventory and purchasing classes assigned, and you didn't want to lose that information or change it in order to recategorize items as marked for pandemic, sales class is a great way to do that. And it really provides you with a lot of flexibility on reporting. So, like these other components, they all need to be established in the system first. And then once they've been established in the system and defined in the system for both major and minor classes, then they are entered in IC11 at the item master level. And you'll see, those two fields there, those are all just for major and minor purchasing classes. So next up, we have substitutes. Looks like we have a question. Can attributes be assigned to X items in contract management? That is a great question, Dan. And I don't know the answer off the top of my head. So, that's a matter of, can you take the specials that you have in contract management and assign attributes there? So that would really be to categorize those items probably in Cloud Suite. We'll find out the answer for you and get back to you on that, Dan. It's a good one. Substitute items. So these, I kind of find that substitute practices really run the gamut across organizations. They're tricky, and it's really hard to maintain leading practices when it comes to substitutes. But the IC13 field in Infor is really underutilized. It's for associated items. So there are two types of associated items, and one of those types is substitute. So again, you can have a one-to-many relationship here. You can enter as many substitutes as you want. The only kind of catch here is that, this does require you to build an item master record for all of these substitutes in order to link them. But it's worth having that information documented in the system. There is functionality that you can leverage based on what's entered here into this form for your items, and we'll get into that later when we talk about managing the crisis. But these processes are available to all item master items, both inventory and non-stock, and it just allows you to have visibility and functionality when it comes to substitutes that you don't otherwise. A lot of organizations are just kind of documenting things through item comments, and that's great. Some places aren't documenting them at all. You do want to have that recorded somewhere, but you don't have any functionality when you're just putting it in an item comment, and you don't have a lot of visibility there either. So you also want to know what your resources are, both internal and external. So your internal resources would be things like that committee, your A team that you want to have in place, your risk management plan, your essential supply chain employees, knowing who they are, and having them understand their roles and responsibilities, your physical infrastructure. What kind of space do you have for supplies? What are you working with there? What distribution methods do you have accessible to you when things like this come along and change the nature of your operations by necessity? What can your IT team do for you? You're going to have folks who are usually in the office together. Supply chain is going to be, inventory is going to be working with receiving and the warehouse folks. And, some of those personnel are still going to have to be on site, and some of them are going to mandatorily be remote, as we're seeing today. So, what does your IT response look like? Do all of those folks have what they need to work remotely? If that situation evolves quickly, you're going to want to make sure that your supply chain employees who aren't going to be on site anymore don't have a problem doing their jobs. And also, what do you have available to you in the form of a communication platform? Do you have an internal employee website? Are you kind of managing everything through mass emails today? Do you have a SharePoint site that you're using? What do you have in place so that you're able to communicate these things effectively and across a broad spectrum of recipients within your organization? And then, of course, we have a lot of external resources as well. There's AHRMM, World Health Organization, the CDC. Both of those have just an absolute ton of resources available to anyone looking through their websites. Some of them, social media platforms as well to a varying degree, which could be an easy way to kind of keep up with news coming out of those sources. Your GPO might be able to offer you important tools and information about managing the pandemic. Your distributors and suppliers, information coming out of government and resources that might be available through them. Other partners such as GHX. I know that GHX just sent out a communication about different tools that they have that can be leveraged for supply chain and managing the pandemic situation, and also just your community. What kind of community resources and contacts do you have? What businesses have you partnered with who might be willing to donate things that you need in these critical situations where you're entertaining, different processes and avenues for getting what you need to manage the crisis than you would customarily be relying on.
Sarah, during my talks with a lot of these supply chain folks, they also turn to universities in their communities to help them identify items and try to be a little bit more creative. So it's important to know all of those aspects in the community, even those people that you don't normally reach out to in just everyday business life.
Absolutely. And the kind of third thing to know here is your capacity. What are your options for bulk stores of key items? Does your primary distributor have any obligations to you when it comes to this sort of thing? Do you have the space on site in your own warehouse? Or is there potential other space that can be repurposed in a crisis? And, which items do you need to consider for bulk supply? How many of them? What is it going to take to stock up? And then once you have those supplies, how are you going to work the bulk stores management? Expiration management is really critical, with some things more than others, but we've heard reports through the news of the federal stockpile of PPE being distributed to states, and 100% of the supplies that showed up being expired technically. And maybe with the masks and things like that, it doesn't seem like that big of a deal. But the real concern there is with things like, has the elastic held up, and unless you're able to go in and check all of that, that expiration management is really something to pay attention to. Rotating those supplies in and out of your primary distribution location and supplies, that's kind of part and parcel to managing the expiration of those items. How are you going to replenish them? When I was managing our pandemic stores, back when I was on the client side in my former life, even in totally normal times, outside of flu season and what have you, it was a big effort to replenish those supplies when we did start to, move things out to avoid expiration, because we were ordering entire pallets of supplies at one time from our primary distributor. And that really throws a monkey wrench into their forecasting and things like that, and whatever allocation they may have you on. So we would plan those things more than a month in advance to make sure that we were able to secure full pallets of product, that we weren't going to get it piecemeal, that it wasn't going to end up being back ordered, things like that. And touch points, that's, again, stuff just like checking the elastic, making sure that the product is holding up well wherever you're storing it, and then other concerns like environmental temperature control. And then beyond that, like, how well controlled is your perpetual inventory? Who has access to that and when? In a pandemic situation, you might have to look into, do you have a space that you can really secure and lock down for those critical pandemic supplies so they don't walk out the door every time that you turn around? And, it's a difficult consideration, but it's an important one. Do you have any space that you can make more secure than your regular inventory space, to keep better control over the distribution of these critical supplies?
That's true. In my research, I found out some people had a warehouse that they could actually utilize, and they ordered 1 million masks, and that's like 350 pallets. So if you could just imagine the inventory space, the warehouse space that you need to keep some of these supplies, you may have to go to trailers. So it's best to be prepared on what you're going to do with these. And also, people become very creative. One client had nurses come down every hour to get a particular supply, and they realized, well, they were stockpiling. So it's not really fair to one department that has plenty and then the other department has none. So it's very important to put those under lock and key during the pandemic times.
And they were changing it up too, right? They were sending a different nurse every time.
Yes, a different nurse every time. So they didn't catch on until, they ran the reports and things looked a little off. So then they figured out which department was doing that and they rectified the situation. But people are going to be creative, right? Because we don't want to be without. All right.
It's a nice word for sneaky.
Yes, it is.
Creative.
Streamline your toolkit. You may find yourself needing to quickly and easily create new locations or perpetuals or PARs, or even requesting locations. So it's important, not to have to scurry during a pandemic to make this happen. So think ahead, go ahead and have your processes that are documented and understood. Create upload templates. For those of you that have add-ins, you can create templates that will facilitate the builds in your ads. You can use them in your everyday daily life, but also during a pandemic when it's total chaos, you're going to want those ready. Or same with Spreadsheet Designer and Cloud Suite. Have those ready so that you can populate the information rather quickly, and then retaining the information in an organized way in case you need to undo it. So you've done your uploads, and now you want to go and undo that. So make sure that you are organized and that you have all of this prepared prior to the chaos that starts and in the future. Stay a step ahead. Identify suppliers, distributors, manufacturers who will be affected by the pandemic. One of my clients couldn't get swabs in. That was in Italy, and Italy was closed down. There were travel restrictions, manufacturing, closed borders. They couldn't get swabs in. So identify your suppliers. Identify the supplies and where they're coming from. Seek alternatives where your substitutes come in. Develop a business continuity plan with your suppliers. Make sure that continues and is operational over the course of time. Make sure your buyers understand the process of prepays. A lot of time they don't have to deal with it. If you're dealing with international companies, you're kind of accustomed to prepays. But if you're not, make sure you know how to do a prepay. If you have to do 50% up front, or you have to pay the entire PO, the entire order up front, make sure you know how to do that instead of trying to figure it out on the fly. Pre-qualify alternative suppliers. And if there's no alternative supplier, then increase your inventory levels. A lot of people have gone to low unit of measure and just in time for, come up with different inventory strategies as it relates to those critical items. Maybe on those critical items, you don't want to do low unit of measure, or you want to maybe look at patients, your patient count instead, and do a model from that point on as to how much of those supplies you're going to need in-house. Very difficult to do that when, you're all scurrying to get supplies in.
Right. And, just kind of do whatever that you are able to do to run a tighter ship in general. That will position you much better to weather the storm when it comes. Stay on top of your order expediting. Be running that PO 223 report. Be updating your expected delivery dates so that you really know when something should have been delivered and hasn't been received yet. And that obviously goes hand in hand with back order management as well. If you're using EDI and you're not currently using the EDI 855 confirmations, consider doing that. That it is a little bit of work. It is something that, we can help with if you want to institute that process in the future, or if you have the bandwidth to do it now, because that can be combined with, an IPA flow and automatically distribute a nice back order report to your buyers or the key folks who need to review that to really stay on top of your back order management practices. Because if that's kind of a mess in your everyday life, it's going to become that much greater of a pain point in these pandemic situations. How loose or tight are your off hours supply practices? Do you have product walking out of the warehouse all of the time? Which obviously, it impacts the next bullet here, which is stock on hand accuracy. There are a lot of organizations who are, running their reorder advice, and then someone is walking the floor and checking to make sure that all of those numbers are actually accurate, and they're tweaking things. And they may think that that's working fine for them now. But what's really happening there is you're spending time that you shouldn't have to be spending because your data integrity isn't there, and you can't trust the system to function as it's meant to, and save you the trouble of being out there and physically checking on the stock on hand levels of all of these products. Again, that's something that you're going to want to save that time of having to do that on a daily basis, or feeling like you have to do that on a daily basis to be confident in the purchase orders that are going out to replenish your inventory, and use that for other things when you're in a crisis situation. Do you have good substitute best practices in place? I can't say enough about how neglected substitutes are, and yet they're just so critically important. It's really an area that you want to focus on. If you don't have good practices in place that are serving your organization well, as soon as you're able to, when you get some relief in the situation and your bandwidth opens up a little bit more, put that on your list of initiatives to focus on. And also your product vetting process. Is that clear to everybody? Is it streamlined? Do folks understand the steps and the order and know their roles and responsibilities, so that when you're faced with, getting a new product in, or you're getting something from a supplier that you're not necessarily sure is going to meet your requirements, you don't want to spend a whole bunch of time only to find out that product is not going to be satisfactory to you. So you want that process to be in place and understood ahead of time, so that it's just, works like clockwork when you really need it to.
So on the substitutions, Sarah, on substitute items, a lot of people put them in the comments. And when you put them in the comments, they're not easily reportable. It's very difficult to get those comments out of the system. So using that substitute functionality within the Lawson system surely would make everything go a lot smoother and quicker.
Mm-hmm.
But also, you have to run a tight ship, but you also need to be flexible. And I think a lot of organizations learned that through this pandemic. Know what your distribution is. How are we going to get supplies to and from the other locations? One client consolidated their orders, and so they placed a rather large order not to bog down the supplier's ordering system, and then they had pallets upon pallets coming to one location. Well, how do we get them to the other facilities? If you have your own logistics distribution center, then you can move them yourself. This particular client had already had a contract with a local moving company, so they brought them in every day. We need you to move supplies from our warehouse to our other facilities, making sure you have the right personnel. This very same client has desktop delivery, and no one wants to go near a hospital during a pandemic to begin with, never mind go in and now deliver to desktop. So their receiving personnel stepped up to the plate, and they actually took those desktop delivery items and did the deliveries themselves. So even though we need to have a tight ship and have control, we also need to be flexible. Product practice changes during COVID-19. Everybody's looking at every possible alternative. We talk about patient gowns. They were looking at raincoats. They were looking at garbage bags. Well, normally, if you're going to change a product, it has to go through a committee and it has to be approved. So during that time, you have to have a little bit more flexibility to be able to get in alternative supplies. And then product lending, donations, and retail options. That same client, who I think has done a phenomenal job through this whole process, had some masks donated to them from Target, and they weren't expecting that donation. They just arrived, they validated, yep, these supplies were being donated by Target, and they were able to give every employee a mask. Well, from that mask, then if we're not going to get any more, how do we keep using those masks? And they found out brown paper bags was the moisture away from those masks. So then they were purchasing brown paper bags. They bought white ones. Brown ones work better, by the way. So you have to be very, very flexible during this process. Or the KN95 masks, they weren't fitting. So they were creative. They found an app that would take a picture of your face and create a gasket. And so they're figuring out how can they use that. So now with this gasket, it will fit the employee's face well. So run a tight ship, but also be very flexible. How do you get things approved so quickly? You're buying 1 million masks. How do you get that funding approved in a timely manner so you don't lose out on that purchase? So very important to also be flexible. The pandemic life cycle.
Yes, I think we have to pick up the pace here.
Okay, go ahead.
All right, so we're just going to quickly talk through the pandemic life cycle. This is really an overview. This is how the World Health Organization phases out pandemics. 1 through 3 is predominantly animal infection with, limited or no human infection. Then we move on to sustained human-to-human transmission. We are, unfortunately, at the top of this little curve with widespread human infection. And then we have post-peak and post-pandemic, which are fairly self-explanatory. This graphic isn't the best quality, but this kind of connects the phases of the pandemic to the phases of your risk management plan. So I thought this would be nice to include. Your interpandemic phase, because we will have more pandemics, unfortunately, is where you want to focus on preparedness. Obviously, response is dedicated to the pandemic phase. Recovery and transition go hand in hand, and then you really return to just planning and preparation in that next interpandemic phase. I won't talk through all of these, but this just kind of goes through the pandemic life cycle as the different phases tend to impact supply chain. So pre-pandemic, there's a lot of uncertainty about how the next pandemic is going to impact your organization and your supply chain. And then when the pandemic initially breaks out, there's a lot of just kind of confusion about, how do we forecast for this? What is this really going to mean for us? And then, pandemic growth and supply chain interruption, that's when you're really in the thick of it. You're not able to get the supplies that you need in, your original items are back ordered, and then your substitute items go on back order, and it just kind of follows this chain because everybody's scrambling around and trying the same alternatives and things like that. And then you have your recovery where things start to get back to normal, supply chain starts to operate a little bit more like it used to. And then post-pandemic, you're really just looking to implement those lessons learned and get back to a state of better preparedness using the information that you kind of got by trial through fire from the last pandemic.
So know the warning signs. We can start seeing it by absenteeism, changes in demand patterns. Pay attention to your supply chain lead times, and then the interruption of supply and delivery. It's important to see what's happening in the world. Pay attention to all of those organizations that Sarah mentioned early on to make sure that you can see the warning signs. How do we manage the crisis?
Yeah, so we're still kind of in the thick of this. And even though, our focus here today is pandemic preparedness, we recognize that we are still definitely not out of the woods. We could have a second wave coming. Nobody really knows what the fall and seasonal changes are going to bring. So we did want to give you some good information and some recommendations about things that you can hopefully focus in on today. So, the recommendation is to pay more attention to patient volume than days on hand. That days on hand information is going to fluctuate wildly, and it's a system estimate that is only as good as the data that's going into it. And your usage information is going to be skewed if you've been stocked out of a product for, weeks at a time. So just be careful about that and try to use other more accurate benchmarks when you need to. Know what your vendor allocations are. You don't want to just be throwing a whole bunch of POs out there that are never going to be filled because you've reached your allocation and then they start showing up on your expedite report and people are following up pointlessly to say, where's this product, when you're never going to get it because, you have a limit on what you can order for certain things. Adjust your reorder levels and even consider changing your reorder method for those pandemic supplies if that's appropriate. Manage all of this closely with your distributors so that you understand what you can expect from them. Definitely expect impact to item pricing. We see a lot of, I don't want to call it price gouging, but you're going to pay more. You're going to end up having to source some of these items from distributors that you don't necessarily have contracts or agreements in place with, and it's going to be more expensive. And if you can possibly avoid it, do not order your catalog items as specials. If you need to source things from alternative distributors, put them in your vendor agreements, put them in contract management, make sure that you have a vendor item record for them, order them the right way so that you can track the usage, so that you can receive them in under the item master number. Just try to avoid that. There are too many manual touch points there, and it's unnecessary. And just something to be avoided, because if you make a mistake ordering a special that really should be an item master number, figuring that out and backtracking and cleaning up your data after the fact during a pandemic is not anything anybody wants to be doing. We'll talk quickly about back orders. We'll definitely have to fly through the rest of this. Apparently we had too much content, but I guess that's better than not enough. So just revisiting that PO 223 recommendation. As you can see here, you can run that by attribute. So if you don't have the time to do your regular order expediting during the pandemic crisis, you can narrow it down to just laser focus on those items that you've identified as critical supplies. Substitute items, use, this slide isn't completely updated, so I apologize. But use that IC13 associated items, track everything, track absolutely everything. If there's something that you are using that's only valid as a substitute during a crisis situation, and you don't want it to be in use indefinitely, this IC13 has basically start and stop dates for when that substitute item should be considered valid. So use that. The replacement item field in IC11 in your item master, this is more underutilized functionality. If you have your substitute item built in your item master, you can plug that item master number into the replacement item field. And if there is insufficient stock on hand to fill a request for the original item, the system will automatically substitute in the product that you've placed in the replacement item field. So you can actually use this to create a hierarchy of products that can be used in place of one another. So maybe you get to a point where you have 4 different N95 masks, or 4 different hand sanitizers that you're carrying, and some of them are preferable to another. You can essentially use this replacement item field in the item master to set up a cascading replacement of those items as orders come in for the original. If there's stock on hand of the original, it will fill with what's being requested. If there isn't sufficient stock on hand to fill that request, it will automatically replace it, and it'll go down the line until it hits something where there is enough stock on hand. So I wish we got to talk a little bit more about substitutes, but I've done too much talking.
We only have a few minutes left, or I think a minute left, but make sure you have your inventory leading practices, positioning your warehouse, identify and review your storage capacities. You have your emergency supplies to be isolated. You have alternative storage unit options. You maybe might want to use a bin management with 2-bin inventory control method. Assess your shelf space and utilization. Keep track of expenses. As you're issuing pandemic supplies, keep track of your inventory errors. Pay attention to unit of measures. A box may be of 300 or it may be of 1,000. Watch for unexpected affiliate items such as your renal supplies that came out of COVID-19, and forecast and try and plan your recovery time. Control your distribution. Who gets what? How are you going to get your supplies from point A to point B? Is it third-party delivery? Is it distributor to supplier to your department locations? Avoiding your storeroom loss. Make sure everything is visible and you have a good receiving process. Buying large quantities. Make sure you have the storing capacity and the staffing to move that.
And then reporting and analytics. So we have, some recommendations for what's delivered, and then, options for what you might want to build custom. This list here is just, we're looking for what in the system can be leveraged today by people who are looking for tools to help continue managing this pandemic situation. We've already touched on the expediting report more than once. Consider setting up your IC 243 killed item report to automatically be distributed to the folks who would want to have that information on, say, a daily basis. Send it to their inbox, send it to their printer. That can be pretty easily done. That obviously only applies if you have your setup to kill items off of requisitions when there isn't enough stock on hand. IC 145, stock status report. Another underappreciated, underutilized one is the MM 280, departmental expense report. That's going to cast a pretty wide net, but it can also good information. Potential overstock might be of value to you. If you are not kill, you are set up for fill. That WH226 backorder report is going to be what you would want to use instead of the killed item report. And for those of you who do have burst, there are some critical item dashboards that Infor has prepared and can deliver. It does require you to submit an Infor Extreme ticket, and it's only available to some customers as noted here. And then, the custom options I think are pretty well known to most people. And I know we're over time, I'm sorry. You can breeze through these, Lisa. They're just screenshots of the different reports that were mentioned.
So ask yourself, how did your committee function? Are there membership changes? Did your plans and procedures adequately support the operation? What conversations should you have with your distributor to prepare for the next time? Did you encounter previously unidentified risks? What are those risks? So ask yourself, what could you have done better, and be prepared if we do, God forbid, have the second round of COVID-19 or for the next pandemic. Make sure your staff working remotely had the adequate equipment and access. Slice and dice your data. Do a lot of analytics to make sure that you gain some insight in how your supply chain team functioned and how things happened during the pandemic. Go back and look at your lessons learned. And then there is a silver lining to all of this. You'll have an improved intra-organization communication, spotlight on supply chain, who did a great job, kudos. Your voice carries more weight for a time, and then great opportunity to institute needed changes.